What do you do in between DEXA scans to know if your osteoporosis treatment is actually working and if your bones are getting better or if they're getting worse? That is where bone turnover markers come in. But which ones are best? Who should be testing them? How often? And what changes should you see on the results? That's what we're talking about today. The latest on bone turnover markers in 2024 for men with osteoporosis and their clinicians. My name's Dr. Tom Forfa, and I'm a retired medical doctor. I was diagnosed with early onset osteoporosis almost 4 years ago now, and I reversed it naturally, drug-free, using my knowledge and medical skills to research and understand what has to be done to strengthen bone. Now I'm on a mission to help other men do the same. So bone turnover markers, or BTMs for short, are special signals in the body released when bones are being fixed or broken down. They can be checked by testing blood or urine samples, giving important clues about how fast your bones are changing. And there are 3 important steps that you must take when using BTMs to manage osteoporosis treatment. But before I give you these steps, when I was treating my own osteoporosis, I was frustrated by the fact that I had to wait 12 to 24 months before getting a DEXA scan. That's a long time to wait to see if your bones are getting better or worse. Even so, DEXA scans can be inconvenient, expensive, and not always easy to get. Plus, they might not show changes in bone density right away after starting treatment. That's why BTMs are recommended as short-term monitoring tools for your osteoporosis treatment. Now, by the way, all the studies and references for this are in the description below. So, unlike DEXA scans, BTM levels change quickly when bones are getting stronger or weaker. This makes them really useful for checking how treatment is working. They also help men stick to the treatment plan. Keeping track of BTMs can have a big impact on a man's feelings and thoughts about his treatment. I personally wanted to know if all the things that I was working so hard on were having a positive effect. Not knowing was a problem. As we know, treating osteoporosis takes a long time and needs a lot of trust in the process. The treatment doesn't show changes that are visible to the eye. So having frequent check-ins with BTMs can help us feel better about sticking with our treatment plan. And if that's the only reason to do them, then in my opinion, it's worth doing because it may increase the chances of a positive outcome. So there are 2 main types of BTMs. Now, this is the important bit. Firstly, bone formation markers. These show how fast bones are growing. There are a number of these, but the most common include total alkaline phosphatase, bone-specific alkaline phosphatase, P1NP, and osteocalcin. Secondly, we've got bone resorption markers. These show how fast bones are breaking down. Common examples here are hydroxyproline, pyridinoline, it's a bit of a mouthful, CTX1 and NTX1. So we need to track one of each. One BTM for bone formation and one for bone resorption, because the balance of resorption versus formation is what we really want to know. The Osteoporosis Foundation and the International Federation of Clinical Chemistry recommend that we use serum P1NP to see how fast bones are growing and CTX1 to see how fast bones are breaking down. So here are the 3 steps to using BTMs for tracking your treatment progress. Step number 1, start with a baseline. Before starting treatment, doctors should check BTM levels to understand how severe the bone problem is. Step number 2, regular follow-up testing. Doctors should keep testing BTM levels over time to see if treatment is working. How often depends on the treatment you're receiving, and you can see the studies in the description below here for more on that. But generally speaking, once a quarter is sufficient. In a second, I'm going to give you the important changes to look for in the BTMs on your blood test to make sure that the treatment is working. And the third step to using BTMs is to adjust treatment promptly. If the BTM levels don't improve as expected, you or your doctor might want to change the treatment, and this might involve trying something different, changing medications, or changing the dosage. But if you're on a medication, you should speak to your doctor about if you want to make any adjustments there. And if you want to know what to do to improve your bone strength and quality, then you should join our Stronger Bones program. It's specifically designed for men who were recently diagnosed with osteoporosis. You can find out more about it in the link in the description. So here are the changes to look for in your BTM blood tests. Now, they're going to vary depending on what kind of treatment you're having. But generally speaking, CTX1 and P1NP will move together because of something called coupling. This is just how bones work because, for more bone to be created, some bone has to be broken down first. So the formation and resorption markers tend to move together. But what we want to see is for CTX1 to drop, meaning less bone is being broken down, and we want P1NP to go up, meaning that more bone is being created. Also, the total levels here are important as well. High levels of BTMs have been associated with fast bone loss and increased risk of fracture. So generally, we want the total levels to go down over time as well. Now, if you're taking bone medications, these levels will change depending on which medication you're taking. So for example, for anti-resorptive agents like bisphosphonates, selective estrogen receptor modulators, denosumab, you're going to see a reduction in bone resorption markers, followed by a later reduction in bone formation markers. Whereas anabolic therapies like tirapatide, there is an increase in formation markers, followed by a smaller increase in resorption markers. So generally, a temporary increase in P1NP and a long-lasting decrease in CTX1 can be a useful sign of effective treatment. But look, there are some problems with using BTMs that you need to be aware of. Now, when looking at BTM results, it's important to think of a few things. Firstly, things like age, gender, kidney health, and other health conditions and medications which can affect BTM levels. Also, after someone breaks a bone, it can take up to a year before, or more sometimes, for BTM levels to go back to normal. And this is especially true in the first 6 months after a break. And in the past, there used to be a lot of differences in BTM levels because of how our bodies work. But now, better tests and paying close attention to how we measure BTMs have made things better. So BTMs in blood are more consistent as well because of how our bodies work compared to the old BTMs measured in urine. And still, there are differences in BTM levels over time, and different labs might test BTMs in different ways. So this can affect how we understand the results. So try to stick to the same lab. But the latest in 2024 is that bone turnover markers are very helpful for checking how well treatment is working for osteoporosis in men. They give us more information about bone health and treatment success than just checking bone density alone. So using BTMs along with other tests can help you and your doctor make treatment plans that fit your needs, which can reduce the risk of breaking bones and make life better for men with osteoporosis. So help us get this message out to more men with osteoporosis by subscribing to our channel.